Bismillah ar-Rahman ar-Rahim. Thank you, Misbah, for your kind introduction. At the outset, I'd like to thank the organizers and the friends like Adil, Misbah, Khalid, who have invited me here. The three previous speakers have made my life easy with Akhtar, Sandeed, and Adil, elaborating quite a lot of what member associations shall be doing. My talk is, what is the role of member associations in managing people with diabetes? And this is me from Diabetic Association of Pakistan and Bakar Institute of Diabetes Endocrine. And what I'll be covering is these 5 topics. The epidemiological surveys and disease prevention is important role of member associations, policy development and advocacy, taking it to community service and standardization of care, then networking and media campaigns, and finally, capacity strengthening. So as regards the surveys, the first survey in Pakistan was done by the late Prof. Shera. That was 94 to 98 with Hilary King. And the results at that stage were nearly 20% of glucose homeostasis with 11% of diabetes. We then in 2016, 2017 did this survey with the help of the ministry. And as have been discussed, the numbers are staggering. 26% of diabetes, 14% of pre-diabetes make it 40%, 40% of glucose homeostasis. And these are the numbers quoted. We are the 3rd in the world now as regards the number of people with diabetes. What shall be done? And as has been discussed, primary prevention is the call of the day from member associations, from IDF. We are privileged to have Akhtar here, who has been supporting Pakistan for the last 20 years regarding various scientific and research endeavors. And this was our primary prevention study, as has been done in America and in Germany and in various places. We looked at the lifestyle and lifestyle plus metformin, and the numbers are very good. In fact, 71 to 76% of risk reduction can be done by primary prevention and intervention with lifestyle. This is what we came up with after 12 years of studies, a rapid score, which takes 30 seconds for each of us to know what their score is. If the total is 4 or more, you are at the risk of developing diabetes. Kindly contact your doctor. So this is a rapid score which we are now using in Pakistan for primary prevention program. I was pleased this morning in breakfast when Nadima told me that she in Jordan is using the same score for primary prevention program in Jordan. Coming down to policy development, what's the point of knowing the numbers if we are not able to make differences in the policy? So the responsibility of member association is to go for policy making. This document was developed by Prof. Shera when he was with Sanya Nishtar and the ministry involved way back 20 years ago. And they were suggesting that screening, risk assessment, and management of diabetes in primary prevention settings. This is National Action Plan developed by them. We then in 2014 gathered various stakeholders, ministry, IDF, WDF, WHO, Diabetic Association, and this was Pakistan Diabetes Leadership Forum, again coming up with suggestions for policy makers. In 2017, 2 of our provinces, KPK and Punjab, they started to develop PC1, which is a policy document for diabetes care in the provincial levels. Lately, we had success in Sindh as well. So there are government documents for having diabetes and NCD care. There are NCD cells developing across the country. We have very lately entered into memorandum of understandings with PPHI, which is Private Public Health Initiative, with the Ministry of Sindh for the standardization of care. Mind you, in Pakistan now, health is devaluated to devolve to provincial level. So 4 provinces will have to have their own policies. So we in Sindh have been able to have a standardization of care policy, at least by advocacy. This is something I like to show. Recent National Risk Factor Survey time-bound national targets, operational policy, vertical programs for addressing overweight, obesity, physical activity, etc. And you can see that many of these are achieved in places like Bahrain, Kuwait, Oman, Qatar, Saudi Arabia, and Emirates because they can afford to. These are the roles of the member associations, even with limited resources. Unfortunately, Pakistan is not doing too great right now, and many of the countries, Egypt is perhaps between them. The other thing we need to do is to have policies on marketing of food to children, policies to reduce salt consumption, policies on saturated fatty acids, trans fatty acids elimination, etc., etc. And then finally, taxes on sweetened beverages. So we in Pakistan have been a part of this campaign for the last 2 years. We want to have a health levy on sweetened sugar beverages. We feel that if we are able to have the FED increased, we will be able to generate a revenue of 60 billion. If we have 1 rupee, 250 ml bottle, we'll be able to generate another 55. So 115 billion rupees can be used to promote health and education if this tax is levied. We were able to take this last year to our Federal Revenue Board, Ministry of Finance, Ministry of Health, etc. It was supposed to come in the budget after 2 days. And within those 48 hours, one of our dear friends, so I can say, from a beverage company, he approached the Ministry of Health and Minister of Finance and told them that diabetes is not bigger problem. Bigger problem is this growth stunting in Pakistan. So why levy taxes on sweetened beverages? Let them continue. And we give you 500 million rupees to have health and sanitation, greenery in Pakistan, etc., etc. So we failed desperately and badly. And this year, we are again hoping that there will be changes. I'm just after the session going to attend a meeting in which we have invited ministers to please listen to the call. Jamal Bilkadir have asked us that in MENA region, we shall share this paperwork with the MENA region so that MENA region as a region does this campaign of levying taxes. This is part of the member associations. We are pleased that at least one of the provinces, Punjab Food Regulatory Authority, the Diabetic Association regarding the excise duty. The other role of standardization of care, insulin access have been talked about in IDF. We in part for the last 14 years have been free to non-afforded in the province of Sindh. 34 type 1 model clinics have been established in insulin. We then went to another very depleted province, which is Balochistan, in fact, the most depleted in our country. And that last year, 350 type 1 children are getting free insulin there. We have now started a project, Novo Nordisk and Roche and SPAD. We are going to give 3,000 children free insulins across the country in the next 5 years. We should have data, and this is the responsibility of the member associations. We developed a Diabetes of Pakistan. Nadima is here. She will remember we came to Jordan when we had IDF MENA Congress there. We did a workshop, how shall low middle income countries or middle countries. Our registry has been selected the last time the IDF published their diabetes epidemiology book. So Pakistan's registry is the representative of low middle income countries. Guidelines shall be developed by the member associations. Prof. Shera and me and quite a few people developed the first document in 1999, which was revisited and revised in 2016. It was then taken to MENA Regional Council, who kindly approved it with obviously some changes to make it applicable across the region. Lately, only yesterday, I got the mail from Journal of Diabetology, Mohan, the editor, that our latest revision of the IDF MENA guidelines have been accepted for publication in Journal of Diabetology, will be coming perhaps in the next edition or so. Then the role of member association is to do networking and media campaigns. So invite celebrities. I don't know how many of you are fans of cricket, but Wasim Akram is a renowned cricketer across the globe, and he's a diabetes ambassador now. He developed diabetes when he was a player at the age of 19. And so now after 36 years of type 1 diabetes, he is as fit as a fiddle and have been invited by IDF as a diabetes ambassador in the past. We developed a Pakistan working group on diabetic foot. This was 2006, when people like Andrew Bolton, Carol Barker, Akhtar Hussain, Rhys Williams, Mahin Vijay Surya, to name a few, came and honored us by their presence. We had this study done again by the mentorship and support of Akhtar Hussain, 8 countries, 17 centers, to look at the genomic and lifestyle predictors for rising of diabetes in places like Pakistan, India, Bangladesh, etc. We are now embarking on new projects with the University of York. And I suppose these are the jobs and the roles which member associations ought to take to combat this epidemic across the globe. The final is capacity strengthening. That this is the job, I feel, of member associations to develop primary care physicians, to develop diabetes educators. The role of diabetes educators in Pakistan was unknown till we started training diabetes educators. We established National Association of Diabetes Educators of Pakistan. I am sure many of you would know Iram Ghafoor, who is our IDF YLD lead. She is the General Secretary right now of this association. And again, as Adil and Jackie and Sandeed are being welcome, inshallah, in the next IDF board, she is also one of the candidates to be considered for elections. Gestational diabetes can't be neglected. We developed a GDM advocacy board, chancellor originally from Bangladesh, and Professor Noorjan Samad, wife of the late Prof. Shera, to develop gestational diabetes guidelines. IDF asked for a theme for nurses. We in Pakistan have got 0.1 million nurses, 0.1 million lady health visitors, and nearly 0.1 million midwives across the country. They've always not been neglected, but not been considered as part of diabetes care by the medical fraternity, and we know the reasons. So we, from 2020, have started targeting on them. Last year, we had a major program with the nurses. Only very recently, last week, I have been given the good news that our target to develop post-basic diploma in nursing for diabetes have been approved by the Pakistan Nursing Council. So soon we will be getting the nurses trained into diabetes. And this was the workshop where I conducted with the ministry, etc., on the 8th of September. So National Diabetes Program, yes, I remember first time I heard from my mentor, Prof. Shera, and he quoted Professor Mursi Arab, that there shall be national diabetes programs developed by each country, each member association. The small boxes are too many, which you can see have been done or achieved in Pakistan. But the two major boxes still, I think, are remaining to a large extent. One is governance. One is role of multiple stakeholders and the integration. And if we are able to manage that, or in my lifetime, inshallah, that is the time when we will be able to show what low middle income countries or middle income countries have been able to achieve. I like to quote here Brazil. In Brazil, what I understand now is that as soon as you are developed or diagnosed a person with diabetes, your healthcare is free of cost then till you survive. We are targeting such programs in countries like Pakistan. It may take time, but nevertheless, we have to continue making effort. Before I end, I like to thank the international associations and collaborations and my national associations and collaborations for the efforts they are doing to support us in this cause to fight 33 million people with diabetes in Pakistan. Thank you all for your attention. Thank you.